Although cigarette smoking has declined significantly since 1964, disparities in tobacco use remain across groups defined by race, ethnicity, educational level, and socioeconomic status. The target group population for this service announcement would be the USF students that smoke in order to cope with certain inequities. According to the Surgeon General, 88% of smokers begin smoking at the age of 18. This is also right around the time that students start attending college. Given that USF is a smoke-free campus, there are still several students that seem to ignore this policy. On the west side of the library, behind certain buildings, and in the parking garages are some of the areas that are common for students to partake in this action. The state of Florida has created the Tobacco-Free Florida State Policy to further lower the cost of health care by preventing tobacco use and promoting cessation among young, vulnerable populations and Floridians. To take the state policy a step further, the University of South Florida has become a smoke-free campus on January 4, 2016. By becoming a smoke-free campus, USF has committed to provide a safer, healthier, and more enjoyable learning, living, and working environment for its students. This picture here shows all the different types of places in your body that one may get cancer by smoking. Given that tobacco smoke contains more than 7,000 chemicals, about 70 of them are known to cause cancer. Smoking cigarettes is the #1 risk factor for lung cancer. Researchers have found that a higher density of tobacco retailers are in low-income neighborhoods. Given that our main campus is located in such a central area, it is easy for USF students to access cigarettes from gas stations and convenience stores nearby. Students indulge in these habits for many reasons. One's mental health can easily be impacted while dealing with all different types of stress, from maintaining one's education and dealing with paying back loans and student debt. Also, adults with less than a high school education have less success in quitting than those with a college education or greater. With my graded proposition at hand, we will be able to significantly reduce the number of students that continue to smoke on campus and hopefully off campus as well. In a simple 3-step process, first we would partner up with USF's student government organization and with the College of Public Health and create a survey that students will take on campus. While keeping the identity of the students or staff members anonymous, the survey would consist of several questions. Some of the questions being whether they are smokers and if so, how often, or whether they are dealing with stress related to school or money, and whether they are aware of smoking policies on campus. Once we have gathered all the data from the survey, we would create a social support group called the Cig-Free Bowl. This new intervention will help students to stop smoking together on campus with one another. This allows students from all different racial backgrounds, different school majors, and having students coming together with a varying socioeconomic status. These students would come together and talk about alternative positive habits like eating healthier, working out more, and meditating together to help each other ease off of cigarette smoking. By using evidence-based interventions, we can lower the number of cigarette smokers here on campus. By providing the proper services and tools needed to do so, we can overcome some of the inequities that cause certain people to feel the need to turn to smoking. Lastly, by creating a culturally appropriate anti-smoking, health marketing, and mass media campaign, we can help reduce the burden of disease among people of low socioeconomic status and the student population here at USF. With the help of USF's student government organization and the College of Public Health, we can create and keep the USF Cig-Free Bowl Twitter account and Facebook page.
Ever since I came to this country, I picked up the habit of smoking cigarettes to deal with my stress and poverty. Now that I'm at USF getting my education, I look forward to joining into the social groups and sharing the experience with my social media followers. I can't wait to stop smoking.